Well, hello everyone. It's like here, talk to you about right here is like talk about is the study about laughing gas. Is like talking about right here is that knowing about that story from that space is like talk about it's like a true story here is basically that whenever I had a surgery it was is that whenever I was going through an operation it's like for it's like for you say for birth defect it was sometime talking about pectus excavata it's talk about with the chest surgery as having the bars having some bars removed. It's like talk about that I think what you call the type of name for it to where for Caden chest it was. And with the story that I'm basically talking about is talking about a study about laughing gas is known about with most of the time in the medical fields it is that they say that that they give some of their patients laughing gas, I guess just to relax them it is. But basically from this experience though that known about that some medical fields that they use it of course that for the patient you help them relax, and of course to put them to sleep of course to before the procedure it is. And during the experience those couple years ago it was is talking about that the procedure back in Christmas near Christmas of 2005 it was showing that you have right here is like you say an example right here of me. It's like I say in the operating room it was that they wheel me to on like what you call it's like kind of like I say like a wheeling medical flatbed it is, I guess if they call them a flatbed. But anyway you have right here and then they would wheel me into another room. It was wheel me into another room, and then and I can notice that they had separate rooms in there of course with the medical fields it was is that you have these separate rooms. One of them that they use I guess for like say another room that where they usually do a lot of their medical stuff is that they usually say that in the medical rooms that they usually keep it at about it's a cool room temperature it is. But anyway they wheel me into the medical room it was, and then knowing about that they would give you like what you call it's like laughing gas it was. And I can remember that my first time of course being on the laughing gas of course was my last time was the last time I've been on there, because I know that whenever I was on it it's like anybody probably think about with laughing gas that if you were to go if I remember right whenever I went to the dentist one time that they would give it to you just to kind of relax you. And when they would give you like some type of shot you say some type of medical diagnosis medical shot is like talking about where they would numb you before they would pull a tooth or something like that. Then a lot of times that they would give you a shot just to be able to numb that part of the mouth from before they pull a tooth it was. And I can remember that a couple of times that they would give you they would have like what you call like be giving you some type of antibiotic that would be relaxing you. And I can remember sometimes that I would go to the dentist, and then just knowing about that kind of a scary situation, because on the other hand too that whenever you space out half the time it just seems like you kind of space out to where that you're trying to figure out where you are what's going on it is. And especially if you can't feel your mouth if they numb your mouth, you can't feel your lip because they numb your lip it is. And then but so far as talk about this medical research is talk about a study about laughing gas is that we could probably think about with the study about laughing gas is which I heard they say on the medical fields. It's like my parents telling me that they did studies about it, and then knowing about what not all patients of course can handle it. And knowing about with me though that whenever I was put on it those couple years ago, I can probably tell anybody here that I did feel like I was going to die. Other than the fact about that if you're going to do some type of procedure it is, and other than what you call is like if you would be fighting in a war or something like that. But other than that, with the experience of say of laughing gas it is, and anybody more likely think about it that if they would be going through a procedure it is, and knowing about that, well, whenever they give it to you, it's supposed to help you go to sleep it is until after the procedure's done it is. But on the other hand too, that with my experience is knowing about is talk about the numb. I guess I can maybe call it. It's like what you call like the feeling. Is like the feeling of it is that miserable feeling. Because on the other hand too, that knowing about is the feeling of it is that whenever they put the mask on you, it's like whenever they put the mask on your face it is, and let's just say the way I got it drawn right here is the machine connected right here, but let's just say that go ahead and use like what you call like the orange, but let's just say if there's a another machine that's connected to it, and maybe like another line right here, and then of course another line, let's just say that this was like what you call like a machine right here that would supply maybe like say along with an airbag or something like that would supply for the gas mask machine it is, and of course they would have like what you call like different flavors that they asked you what flavor would you like your laughing gas, and chocolate, I think caramel and bubble gum, and I can remember I chose bubble gum it was, and I could probably tell anybody here that whenever I think about bubble gum it is, it kind of reminds me a lot of that laughing gas type scent, and that knowing about that the last time I breathed bubble gum that was at one time was whenever I was going through that operation it was, and I could tell anybody that whenever they put the mask on me, I mean it felt a little bit like suffocation, and anybody probably thinking about what suffocation it is like why did it feel like what you call like for suffocation it is knowing about that they which I know more likely for sure something like that, to where that whenever they give it to you a lot of times it's like that there's like let's say attachment about right here, and let's just say the mask was right about right here it is, and whenever they give it to you that they put a mask over your face. I'll go ahead and draw like what right here is a mouth right here, but that they put a mask over your face it is, and then they tell you to tape 3 deep breaths it is, and then you start feeling woozy it is. They'll tell you to you start feeling woozy, and but other than that a lot of times they say that they put the mask over your face. I think that it goes let's say you got the nose right here, let's just say if and then of course your eyes would be at about right here it is. But basically it's a mask that they put over your face it is, and then what's supposed to do is of course is help relax you, and of course to put you to sleep until after the procedure's over with. But with my experience though, that I can still remember those couple of years ago, that with my experience it was a weird feeling, because my whole I would probably say that my whole face went numb, and it felt like of course I was staring of course at the ceiling, and I can remember that seeing they had like what you call like anybody will probably think about what you normally see whenever you're on the operating table it is. Just like in the dentist office, that they have like what you call this light here. I'll go ahead and use the brown right here, but a light at about right here it is, and then they have a few other things to say on the ceiling it is. But this is basically what you kind of see whenever you're say in the operating room or if in the dentist office, if you're just staring at the ceiling it is. And a lot of times is that I can remember that I was feeling really numb, of course on my face it was, and I can remember telling them that I'm feeling woozy now, like I'm feeling woozy now, well good, like, and well take the mask off. And I remember I was telling the doctors that to take the mask off, and I can remember that after about 2 minutes they finally took the mask off, and I can remember that I was taking I would say I took at least 5, maybe 10 deep breaths before I was finally out of it. So they can proceed with the operation. At least 10 breaths on, and I was finally out of it. So that way they can go ahead and continue with the operation it was. And I can remember whenever they pulled me out of that operating room that they would wrap me up, of course, in blankets. Of course, they had these warm blankets, of course. I remember waking up and shivering and stuff, but I can remember that they would wrap me up, of course, in blankets it was, and just knowing about that, I asked them, I'm like, how long have I been out of it? And they were like, for about 20 minutes, and I'm like, well, why am I shaking? And I'm like, well, it's the anesthetic, it's normal, but I can remember that going into the operating room, everything was fine, and talking to the person that I was with, and then knowing about that whenever I went into the operation room, it was just like, the kind of scary experience, because knowing about, you probably think about, the feeling about knowing about dying. It was, the feeling about dying, and it was kind of like that. There's knowing about, experience about knowing a feeling about dying. It was because, on the other hand, too, that whenever your face goes numb, and then knowing about it's a little harder to breathe until they take the mask off, it is. But the whole study about laughing gas is knowing about that, really, for the medical research it is knowing about that really, what is it really used for? To relax you, or is it to help you go to sleep, whichever it is. But a lot of people probably think about that. I would rather like my anesthetic ran through the my IV or something like that. Something maybe ran you through the. If they put something, if they can put something in your nose or have you swallow something, a lot of times they give you an antibiotic to help relax you, just to swallow something, just to help you go to sleep. But on the other hand, too, with my experience about that with laughing gas, is knowing about that they say it's not really what you call laughing gas. Some people may think it's called poison gas, or it's called death gas, or whatever. But on the other hand, too, knowing about it's that type of a study about medical research is that. It's gas, I guess, that more likely that they say that more like it's not recommended. But on the other hand, too, that knowing about with most doctors is that they say that it's on standby for in the operating room most of the time only. But other than that, is talk about, say, the study about laughing gas is talking about is that right here. It's like with the medical stuff, and knowing about with me is like talking about in the study about laughing gas. I'll say near for Christmas 2005. Talk about is a study about laughing gas.